skills, and opportunities. So before we begin, I would like to introduce our speaker and just read a bit about her. Okay, so I'm sorry for that. There was a break in transmission. So Dr. Linda is an innovative medical doctor and passionate problem solver with interests in digital health and improving population health outcomes. She holds a master's degree in public health from the University of Manchester, and during her studies, she completed a systematic review and published Implementing Digital Health in Low and Middle Income Countries. That's a book that provides context relevant insights to empower emerging innovators in low and middle income countries. Experience in digital health includes conceptualization of the Healthify Africa app, then our role as a clinical fellow in digital transformation, which is also our role in quality improvement. She's deeply committed to strengthening capacity and sharing knowledge in digital health across LMICs. Then she holds a strong appreciation for the impactful initiative led by the African Digital Health Solutions Students Network and has previously contributed as a mentor with the organization. So today we are excited to have her join this webinar as a speaker. So right now I'd like to welcome Dr. Linda officially. You're welcome and can begin. You can just react with the clapping emoji to bring her on board. You have the floor, Dr. Linda.
Thank you very much. Thank you, everyone. Good evening, everyone. That's Damilola who just spoke. Thank you so much. I know it's that time of the evening where everybody wants to, quickly get out of here and go have the rest of your night sorted. So I'm hoping that this will be quite a brief session. Just probably spend half of it just talking about what we're going to talk about today. And then the other half, I would like the floor to be open. I'm happy it's kind of like a small group as well. So I want people to ask questions. And if you can put your camera on, that will be quite helpful as well, because it makes it a bit more interactive, if that's okay. So I would like to start by sharing, I've prepared a quick slide to just help us guide us through the day. I'm just going to share that. Right, only the host can share. So Damilola, can I share my slide with you in the chat? Is that possible?
No, you've been made a course, so you can share. Try
okay.
it again.
That's fine. Okay, I'll try that now. Thank you. Okay, just a moment. So while I'm trying to set this up, I want to know who is here. It's very chilled. It's just going to be like a chat. So it's not, I try to make my presentations a bit relaxed and not like, like you're in a lecture hall. And obviously it's evening, so we don't need that energy now. So if you just want to start by letting me know who is here, what your name is or what you currently do, and particularly what your evening. This is quite important to me because when you talk about digital health, different people have different experiences, different people are at different levels of that career ladder. So it's important to know who you're speaking to so that you can tailor the information better. So if you could just start with that while I set up the slide. Thank you. And if you want to put your mic on and just introduce yourself as well, that's really welcome.
Maybe I call names. Okay, so
okay, that's fine. Go ahead.
Yeah, Helen Gaki, can you please introduce yourself? Hello. Okay, I'm not sure this person is here. Okay, I also have Amara. Amara, are you on? You can please introduce yourself. Or anyone who is ready to introduce to come first can raise or just unmute. Raise your hands on mute.
Can you see the slide? Can we see the slide?
Yes, yes, we can. Okay,
Right.
Nicola. We can see it. We can see it. Nicola, you can introduce yourself.
Right. Hi, can you hear me?
Yeah, I can hear you.
All right. I'm not sure if my video is showing. I've been having issues with it all week long. But hi, I'm Nicola and I'm based in Johannesburg, South Africa. I'm currently working as a digital campaigner with ActionAid International with a focus on climate justice. But my background includes working with Doctors Without Borders as a digital health promotion officer. And then later on, I was a digital health promotion analyst as well. So I have
Right.
a really strong interest in digital health, and I'm currently looking for ways to break back into public health because right now I am focused on climate work, but I would really like to break into the digital health space and field. So as part of that, I'm going to be embarking on a journey next year to do a master's in public mental health because I have an interest in digital health advocacy around mental health in Africa. So yeah, I know it's a bit here and there, but yeah, that's a little bit about me. Really happy to be here.
Nice to meet you. That's quite an interesting career portfolio that you have, and I wish you all the best going forward as well. I hope that this
Thank
evening will be useful and insightful as well.
Thank
Okay.
you.
Anyone else who wants to let me know what they are up to? Right. Okay. I'm getting the silence. That's fine. So I've just noticed my slides are. Just let me know what you can see because it does have pictures, but I think it's showing it as black and white. So can you see the picture in that slide?
Yes, it looks pretty small though. I'm not sure if it's supposed to look small. It says navigating a career in digital health.
Right. Can you see the picture on the side with people sitting and, sitting?
No, it's not clear.
No.
It's not clear.
That's the problem. I'm not sure. Right. And this picture is not clear as well, if I'm correct.
Yes, it's not.
Right. Let me just a moment. Can I email this slide to any of you and then you can try sharing from your end
Okay, that's fine.
while I try to start talking, yeah. So I'll just quickly email that and then
All right.
let's see. Yeah. Just a moment, please. Because I've put together like a number of resources that people might find helpful. So that's why I think it would be important to the evening. Okay. So I've sent it to Opayemi while I get started. Okay. Hi, Vivian, joining from Nigeria. I'm a digital health program manager. Looking forward to the conversation. Nice to meet you, Vivian. Okay, so basically, when we talk about digital health and a career in digital health, just let me know in the comment section what comes to your mind. When I was maybe like 2-3 years back, when I hear digital health, what would come to my mind would be startup, being a founder, having built an app, having built a tech product. That was what would come to my mind. So if you could just like randomly just put in the chat, when you hear, oh, I've got a career in digital health, when someone tells you I work in a hospital, you just assume that you're doctors. So when you hear I work in digital health, what do you think? What comes to your mind first? You could just type it in the comment section. Anyone? Innovation and entrepreneurship, that's good. That's from, right, for me, digital arts integrating technology into the health space. Okay, fantastic. Anyone else? Damilola, tech people come to mind at first, not until later when I gradually got into it. Yeah, improving health technology, fantastic. So yeah, I think we've got really good idea of what I think a lot of us from what I'm seeing in the comments have moved from, that initial idea to then someone said, when I got into it, I realized there was more to it. And that's basically the very unique thing about digital health. It's literally like it's another world where there is so much going on. And when I was asked to speak on this, I was like, oh, where do I start from? Because there's so much to explore when you talk about careers in digital health. But I think the common goal, like someone has mentioned, is about improving health outcomes. Opeyemi, have you gotten the slides? Right. If not, I'll just start with this till that comes back in. So the whole essence of today, I have one objective today. I want that by the time we're leaving this conversation today, we are seeing beyond the techie lens, beyond the startup, beyond the innovation product, beyond the pilots, to see actually the fact that there is so much more to digital health and where the world is heading in a few years. Depending on different parts of the world, we experience this at different times. But in some parts of the world, in a few years, digital health will become the norm. It wouldn't be the different thing or the unique thing or the new thing. It would become the routine, because that's the whole idea of when you create an intervention, it sustains, then it goes into routine. So digital health interventions will then become the routine way of life and no longer like that new thing. So going beyond the techie lens is what I hope that we all achieve today, to see what careers are available to people. A bit about myself. I'm passionate about ideas that make healthcare work and more equitable. I enjoy working with people, and unfortunately, I don't like money talk. I'd rather have someone else do the money talk. So that's a bit about me. I did medicine in the University of Nigeria. I got a master's in public health from the University of Manchester. And during that time frame as well, I was quite interested in digital health. So I did my coursework around that, and also my dissertation around understanding how people in low middle income countries, including Nigeria, which is my home country, are implementing digital health innovations and what the challenges are. Why are some working and why are some not working? And basically, I had an award at the end of the day from that as well. So along the line of my journey, I've done so many things, to be fair. About 7 years post-medical school, so it's been a while. I've founded a group called Healthfire Africa, and we've launched an app sometime last year as well, from that whole idea of trying to see how we can help people make healthier lifestyle choices in low middle income countries. And then I've authored this book. And currently, my newest project is something called BreakFit Co, trying to look at how we can help people in office settings reduce their sedentary risk. I'm currently working in the UK as a medical doctor, so it's been a bits and bobs here and there. Quite sorry about the slide. I don't know why it's not showing. But this slide was basically me trying to point out WHO's classification of digital health interventions, and it has 4 broad classifications. It looks at it as from a point of the ones that are related to clients, the ones that are related to different players in the health system, like, maybe information and patient information management systems, which is one aspect of it that works with like hospitals and health centers and things like that. But from a client's perspective, you're looking at apps, you're looking at wearable trackers and all of that sorts. So if you think about how broad, and if you're looking at government aspect as well, you're looking at things like big data, precision medicine, people are using digital health in different means, right? So a career in digital health could literally be anywhere within that point of what digital health does for the health system, including even in low middle income countries. If you talk about vaccines and immunization programs, digital health is being used to optimize delivery services, optimize how information is being shared to people, and also optimize how teams are working to monitor these processes. So it's the other side of medicine. It's a mirror image of medicine, because we're trying to move things from analog to digital. That's basically the way I would like to look at it. So I want to ask today, what does a digital health career mean to you? And having described all the multiple components of what could be digital health interventions, this could range from data science. So there is that person who could work as a founder or as a startup or work on an innovative project. But where healthcare is heading, in the sense that most of these approaches will be very multidisciplinary. That is to say, many people will be working on what eventually works, you would find out that not many people would be doing all the work. A team would need maybe A to H or A to Z number of people to deliver this project. And it would need people with these various expertise, which is why I have listed it out so that you can have more insights about what can come as digital health. It could be the data science aspect of it. It could be expertise in artificial intelligence. It could be market and user research, particularly because now people are moving towards patient patient-centered innovations, things that you don't just go stay in a place, create an innovation and put it into the market. You co-produce your interventions with the patients or the clients or the end users. So that in itself is a field on its own. And then there's the financial planning bits of it. If you're going to be getting grants and things like that, there's product management, there's commercialization, user experience design, grant writing, clinical validation, which I'm not very sure how that works yet in Nigeria. But I know like in places like in the US and in the UK, compliance, clinical validation, these are all very serious areas, because if you're, for instance, saying you're creating an innovation that can help people manage their blood pressure or their blood sugar better, then somebody clinically needs to see that there are no clinical risks being introduced for the patient, either intended or unintended. So that's actually something that I'm not sure, while I was working in Nigeria, I'm not sure how much of a specialty or an area that is. But if anyone has information regarding that, you can also put that in the comment section. And then there's a cybersecurity aspect of it, health informatics, even academia, and even clinical research. So you can see that there's a lot when you talk about a career in digital health. Now, digital health today, I like to look at it as a convergence of expertise to develop better evidence-based health tech. So evidence-based, meaning that it has to be linked to what works and not just what I think or what I feel. And that's where the users are quite important and the data and the research is quite important. Now, this health tech is also safe and compliant with any regulations in the country where it's being launched. So for instance, in the UK here, we have some regulations like ISO standards, DCB standards, which if you're working with the healthcare system, they would expect you to tick these boxes before they can think that they will think you've done things the right way. And then they can think about, having patients, population use that product. But I know that works differently as well in different parts of the world. And then it has to be context relevant and it has to be financially viable. Lastly, it has to be user-centered. So you can take a screenshot of this if you want, but if you look at this message, the way I've created it is just so that you can see that it becomes impossible for one person to be all of this, right? So it makes sense to think that if you're having a career in digital health, you don't have to always be in that founder role or the one with the creating and crafting and doing the idea and doing it all yourself, that you might also be part of a bigger picture, working together as a team and achieving this mutual goal. So let's say that, so the way I like to look at it is, now that you have an idea of what it is that could be in digital health, if at any point anyone feels I'm too fast or I'm too slow, or you have any questions, please ask so that I will know how things are going. And just so I'm sure I'm not talking to myself, you could let me know in the comment section with a reaction if everything is going well, or if you want me to slow down before I continue. Hello? Okay, thank you. Right, okay. So the way I like to look at it is now you know that there's so much going on. It's about finding out where you're standing. Where are you standing? What experience do you have so far? What do you bring to the table? And that then helps you to craft what your next steps are. So if I'm a clinician, for instance, and I want to talk about digital health, I have a better understanding of the problem in the grassroots in terms of like what clinician experiences are. I have feedback from my patients and I have patient data that can help me inform care. And then I can leverage all of this to give clinical insights, carry out clinical risk assessments with teams and all of that. So if that's where I am standing at the moment, I can then say, in what capacity do I want to contribute to digital health? I can be a founder of a product and do that work together with other members of the team, or I can decide to work as part of the team, bringing my expertise to the table, right? In which case, what you need to do is find the skills that make you better at doing that role. So being a core clinician, if you want to go into clinical safety, for instance, there might be courses that you need to do or an internship program that you need to do to help you build expertise in clinical safety, for instance. So that's why I've said, let's take scenario A, starting from if you are a techie. So I went for a talk 2 days ago, 3 days ago, and there was a comment he made. I was preparing this slide and I was like, yeah, that's actually very true. He said, if you're a techie without without healthcare, if you build a digital health product in quotes without any healthcare inputs or healthcare insights, then it's just a digital product. It's just like any other digital product out there. It's not digital health, right? So it just points out how important that a techie needs to do certain things to then make that digital health move. And what would that require? A good grasp of clinical problems, a good grasp of real world health system challenges, patient needs and perspective. And that's one thing that made me have a smile on my face when the lady who mentioned going for a master's in public health, when she mentioned that, I was quite happy to hear that, because really at the end of the day, it's about finding out what you need to do and getting to work with doing it to get yourself where you're headed. So if you're a techie person in this room and you're looking at going into digital health, then it's about finding out how you then get that health experience so that when you're designing a product for a digital health need that you've identified, then you are just not designing a tech product, but something that actually fits healthcare needs. Let me give you an instance. If you're thinking about building an intervention for patients who have high blood pressure, and maybe you want to do a new device that would help them monitor their blood pressure better, but then again, you don't realize that patients, maybe patients take their blood pressure reading when sitting or when lying down, when standing, or something. You just go and maybe you make something that is just out of that's unrealistic, basically, that doesn't suit into how patients' body systems work. You realize that at the end of the day, you'd have spent and this is very important because then health tech is cheap for the masses when it gets to reach them and you've made that impact. But health tech is expensive to build. So you need to be sure that you're getting those things right initially so that you don't get to the end of the road and find out that you spent so much money or invested so much and haven't gotten to where you're headed to. So scenario B would be somebody who's already got background in research or academia. And some people would then think, oh, if I've got research and academia experience, I need to leave that field totally. For me to be in digital health, I have to be working on an app or an innovation. No, we actually need your expertise in research and academia because it's that information that you bring that helps people design better products. And even when products have been designed already, it's the information that you bring in terms of evaluating how these things are working. Let me give you an instance. There's a new app to help women who are pregnant to have all the information that they need to support childbearing and reduce maternal mortality rates. And this researcher just sees this new app and is like, oh, that's very fantastic. I want to compare how this app works and is impacting health outcomes to women who are just, going regularly for antenatal care and just hearing information from everywhere else. I want to compare that population to this population who now has this app with all the comprehensive information and insights and even possibly access to clinicians. So you could do a study, maybe like a prospective study over a period of like 6 months, whatever number of years, maybe 9 months, follow them on through the pregnancy. And then you can then come back to tell us, oh, look, I've done the study and you own this app. This app actually works. It has reduced, compared to the other population, so and so percentage of women had this outcome or didn't have this outcome, or it's not working. And if you give that feedback to the organization, they can then decide to go back to the drawing table and think of how they can improve what they're doing. So in doing this as well from an academia or research point of view, it's important to know what the context relevant trends around you are and also the global topics of interest, particularly because when you align it this way, I'd always tell people aligning things with what's happening globally also opens you up for more funding, to do these researches, because there might be money going around to solve those problems. So when you align with them, then it would also help you with visibility and also probably increase chances of getting funding. So you don't have to like chase these passions by yourself, and also even get you to work in industries that might be looking to solve the same problems that you're solving. So example of focus areas would include maternal and child health for like, low middle income countries, sexual and reproductive health, diabetes management, mental health, or home monitoring devices. Now, scenario C is, for instance, someone who has got a clinical background. And like I said, the way where the world is moving now, in fact, here in the UK, it's hard to find a digital health company that doesn't have a clinical lead. I think it's also a requirement on the DCB I just mentioned, the regulatory standards, that for you to have this product out here, you must have a clinical lead, either working part-time or working full-time, but you must have a clinical lead or a clinical safety officer. So automatically, if you've got a clinical background, you don't need to go learning code, except you want to learn coding because it speaks to your passion, but you don't need to go learning how to code or learning how to, it's like restarting clock all ahead when you can be doing the same, making that impact that you want through digital health in the healthcare system by bringing the skills that you already have to the table. So companies are looking for this medical input to meet real world medical needs and to ensure clinical safety through risk assessments. So a focus on understanding the technology and leveraging clinical experience might just be what you need. And obviously, you don't want to be working with a tech team and they're mentioning, things like, oh, we're working on an agile method, or we're developing a wireframe for this innovation. And you're like, what is all of that? So you actually need to get up to speed with what's happening on the tech part as well. Other areas that people might be interested in is like things like clinical research, like I've mentioned, involvement in clinical trials and study designs for these digital health products. So after the products have come out, and this is even something I think that like people can do, you don't have to wait if you're looking to get into digital health, for instance, and you love research or you have research experience, I think it makes sense now to begin to pick products around you and study those products. Get people recruited, speak to the company, get people, especially if you're going for like a master's program or like any further educational program, get people recruited onto an intervention, speak to the people who have developed the intervention, try to do a study to see X population over Y population, what difference did they make, what impact did they make. That will be quite useful in helping that company even shape the services that they provide, and then also contributing to global knowledge base about what's going on, because really there is a lot of data gap in low middle income countries and Africa at large. So I think that would be quite a helpful untapped area that people should actually begin to look into. The other area is UX and UI, which is user experience and user interface design. And basically it focuses on optimizing a product for effective, enjoyable use. Imagine if you've gotten an app to use and the buttons are nowhere to be found because already your brain has wired around how other apps work. So then you find out that this app, for you to log in, you need to maybe go on another, I don't know, just something very, very confusing and weird. And what do you think happens to most people in that situation? They just log off. They're like, I beg, I'm not using this app today. I've had a very busy day. I don't want to think about this. And possibly they might not even come back to that app ever again. They find another one and they move on. Now, what is the difference between why someone will handle that app that way and another app differently is basically this user interface field of digital health. So these people who go into this area, people probably someone that likes graphic designing or someone who has got other interest around that area. There are also master's programs for that. I think if you're doing a full master's program on this, it might be like maybe like digital designs or something, but then you have components around user interface and user experience. So I'm not very sure what specific masters speak to this, but I know that if you go searching on Google, you would find a number of master's programs or certification programs as well that can help you build up this experience. And then lastly is the startup world and industry. Like we know, the startup world is a very, very interesting. I particularly kept it last for a reason, because that's where a lot of people think about when they think about digital health. It's an exciting world to get an idea as an innovator, get an idea that you have passion about and bring it to the table, and gathering insight from people who are the potential users, doing the market survey to see what's needed, going through all the phases and life cycle of that innovation, creating it, and then having it out there, probably piloting and then finally launching fully. So that's an exciting field as well for someone who is innovative and has that agility and a broad range of skills to help them get that on board. I would always also advise that to get into that field, it would be helpful to work as a team. And also, it would be helpful to see if you've had other experiences that give you insight that you can leverage. Because like I mentioned, it can be quite cost intensive as well. So are we up to speed here? Any questions? Oh, I have 5 comments here. Right, okay, thank you. Are we up to speed? Any questions at this point before we go on to our next steps? Is there anything that's not clear? Is there anything you want me to explain more? Hello, people. Okay, thank you, Jimo.
Okay.
Right. I just like an interactive session. So please, I'm sorry if that's not, I know this time of the evening, people are quite busy. Yeah, but just help me know that what I'm saying is, if it's not tailoring, then let me know so that I can also readjust the information I'm sharing. That's why I'm asking for the interaction. So, okay, thank you, Damilola, as well. So next steps basically from here is, now that we know what digital health is, you see how broad and how extensive it is. First step is defining your baseline. Where are you standing now? Are you a techie who has no health experience? Are you a data analyst who would like to do more in digital health? Are you a clinician who hasn't got a lot of tech experience as well? And whatever it is that your baseline is, right? Now you've found your baseline. You think about the big picture. What do you see yourself doing in digital health? Do you want to be a founder? Have you got a solution that you're trying to solve? Okay, thank you, Zachariah. Have you got a solution that you're trying to provide to the market? What capacity have you got to get that off the ground and rolling? Do you want to go into clinical safety, risk assessment, and all of that, risk management? So if that's the case, what do you need to do to get there? If you're a techie who wants to go into digital health, how do you optimize your health insights so that you be relevant to that context and things like that? Now, once you've identified your baseline and the big picture that you're heading for, also, I think it's important to know that, or to realize that in digital health, it's a very fluid, fast-paced, fast-moving, fast-evolving sector. So people might find that it's not like saying, oh, I'm a medical doctor today. I've finished medical school as a medical doctor, and I'll work my first job as a doctor, my second job as a doctor, my third job as a doctor. It doesn't really work that way for most people in digital health. People's role evolve as they progress, because while you're doing a particular role, you might then pick up some additional skills that are relevant to another role, and then you open yourself up for that, which is why I believe in start wherever and keep pushing, because whatever you're doing is better than doing nothing, and it helps you pick up skills that open the door. So the next step would be identifying those skills that you need to develop to get there. And that would include looking out for, like, are there any internships that you need to take? Are there any courses that you need to do? Free courses, funded courses, scholarships that you need to find to help you upskill and get relevant in that field that you want to go. And I'm a firm believer in that. Even while upskilling, I don't want you to upskill in silence. I want you to upskill with visibility. So are there ways for you to network? Are there events you can attend? Like, fantastic that you're here this evening. When I was a student, I'm not sure everybody here, I don't think everybody here is a student basically, but when I was a student, I don't think we had anything like ADHSN, which is why ADHSN is very dear to me, because I'm like, this is a very beautiful opportunity. I don't think that the digital health curriculum across like Nigeria, where I come from, is as developed as I would love it to be. But having this means that any medical student who has got interest can, begin to know what's happening and leverage opportunities. And that's fantastic. So you're already doing the right thing by being here today. The next would be leveraging any opportunities that you find. And this could include volunteering roles. You don't have to wait till you have a paid role in digital health, because sometimes when you're waiting for a paid role, what are you going to show in the CV for the paid role if you don't have any experience? And that's where volunteering comes in. It doesn't have to be that paid role yet, but if you have an opportunity to volunteer and get work done, then I would advise take it and run with it. If you have an opportunity to do an aspect of any digital health project with a company, reach out to people, reach out to organizations, get that done. If you have an opportunity to be involved in research, get involved and get things rolling. It's way better. If you have an opportunity as well in your workplace where you currently work to advocate for an improvement that is related to digital health, do that. It counts better than having nothing at all related to digital health. My first, outside of my organization, Healthfire Africa, which I founded and created an app for, my first job here in the UK as a digital health a clinical fellow in digital transformation was just based on the fact that I had been doing things in digital health from my organization, and I had piqued interest. And instead of doing like a general public health dissertation, I had done a dissertation that was specific to digital health. And all of that kind of contributed to why I got that job, I would think so. So I would just say, start where you are, do what you can from here and move forward. So this last slide is just a slide of encouragement, basically, and it's beating through the hurdles. I was trying to find an exciting name for it, but I couldn't find. This is the best I could do anyway. So, like I said, this field is very fast-paced and is ever evolving. A couple of years back, I don't think if someone woke up 10 years, someone slept off 10 years ago and woke up today, that they will know what's going on. They would be literally lost. We've gone through so many phases up until now where we have AI. And yesterday I had a meeting with some of my tutors in my program, and he was saying how primary care, which is like in a way where you go to see your doctor in the clinic, how primary care in the UK is going to be changing over a number of maybe a few years, or even some places already changed. But basically, when you come to see your doctor, you put some information online for them, that AI would then make it possible that even before you see the patient, AI would run through all their data to tell you, this patient has just come in with a cough, they've complained about soreness in their chest and the fever. I've looked at their past history and the prevalence of XYZ in their previous presentations. I think this patient has a chest infection, and your current guideline says they should have amoxicillin for 5 days. Do you want me to send that off to the pharmacy? And you're just like sitting down there, you're like, yes or no, so that's not the digital health that we talked about like 5 years ago. This digital health is different from that digital health. And the digital health in 5 years as well would be different. So it's very important that you are a lifelong learner. You don't arrive. There is no arriving, because there's always going to be something new to learn, okay? If you had and like we've mentioned all of those different fields, it also means that, for instance, if you started off in data science, that in 2 years' time, you might be on a project that requires AI experience, and then you upskill into AI, and you might be on another project that requires you to have some kind of insight into clinical safety, and you upskill into that. So you need to be a lifelong learner, have a lifelong learning mindset to help you thrive in digital health. The other part is curiosity and commitment to your path. So if you've picked a path, stay committed. Don't fumble and dabble in all areas, because at the end of the day, you probably will not solidify in any one. It makes sense to solidify in one and then grow to the next, but don't stay touching different areas. You might end up not really being able to prove that you know what you're really doing in any of them anyway. So if you can, that's fantastic. But I'm just trying to say that in terms of kicking off from the ground, it might make sense to pick an area and perfect it and then move to the next, or put it all together. The next is having an innovative mind and being adaptable, because change would always come. Particularly, this is something I think is very important for those who decide to go the startup way or the industry way, because sometimes, particularly because now we're solving problems. In fact, you don't come into problem solving with a solution in mind. You come in with the problem, and then you co-produce and co-design with the people who this problem is pressing the most, to say, what do you see solving this problem for you? And that might also mean that at some point you might end up with a product, but which is why prototyping is quite important. You might end up with something that isn't what they really want. So you need to still go back and be adaptable to get those things changed and suited for them. So that at the end of the day, when you get to your final destination and you pilot and you launch, that product will serve the purpose it was created for and not just be a tick box of, oh, there's a new digital health product in the market, because there are loads and loads of them. So it's about what makes your own stand out, and really where the world is heading. I think it's about that adaptability and making sure that your designs are user-centered. Critical thinking is quite important. Networking and collaborations, very, very key. And talking about even the startup field, it's about finding people, finding someone that shares that passion with you. If you think you can't work alone, who becomes your co-founder? Your co-founder doesn't have to be someone that is like you. Now we've talked about all the different things that are required. Can you find a way to work synergistically with somebody who brings something that you don't have to the table? It's not a friendship party. It's about filling in gaps in what you people are doing to work together as a team to achieve a set goal that improves the health system. So yeah, I would always encourage networking, collaborations, go for events, attend events like this one virtually, in person, and get all of that. On LinkedIn as well, there are I've seen a couple of groups, maybe open groups or closed groups, whichever. But if you find open ones, or if you want to apply for closed groups, that's also good. And they have like very rich, insightful conversations around any field that you're interested in, be it cybersecurity or clinical safety, or even startups generally. And then lastly, because I'm a doctor overall, I would not start talking about the importance of being resilient and having like a well-being mindset, having a package to manage your well-being, particularly for those who go into like the startup world. It can be a lonely journey. It can be a me alone journey. And even as you're deciding to find your path in any other, if you're going for a program, a master's program, or an internship program, or a fellowship, sometimes it can be a lonely journey while you're still trying to navigate your path. So it's important to take rest. It's important to just, have your vision board that you can go back to and say, oh, this was where I wanted to start, but this is where I am. I am not there where I'm going to yet, but I've gotten halfway and I'm still moving on. Okay. So take care of yourself so that at the end of the day, it works out. So far as you're putting in the energy, you're putting in the work, at the end of the day, it works out. You find yourself where you want to be. But if you've not taken care of yourself, then you would, have other things to deal with in terms of your well-being, but you've gotten to the destination anyway. So yeah, manage your well-being and stay resilient. So I've put together a couple of resources that I think might be helpful. This is in 3 slides. I can share this slide at the end of the day to anyone who wants it. But basically just across different areas that we've talked about today. So if you're looking at data science and machine learning, for instance, there are a couple of Coursera and edX courses that you might find helpful. And there is this Google machine learning crash course as well, which is quite practical. Just a number of them basically that I've put together. So you can have a look and see which one that might fit into what you're looking for. If you don't find one, just Google. You will definitely find something, or ask people, go on LinkedIn. Is there someone that you've looked at their profile and you're like, oh, this looks like what I want for myself in the next 5 years. You can reach out to them and ask them, I'm looking at doing this. I want to go into this field. What would you recommend? What would you advise? And then they'll take it from there. And hopefully that insight will help shape what you're doing. So all the best in your individual journeys. That brings us to the end of this presentation. Question time.
Thank you so much, Dr. Linda. That was a very insightful presentation, and I learned so much, and I believe we all have learned one thing or the other. So, it's time for questions. So if you have questions, please signify. Could raise your hand, and you could just type on mute. Thank you.
Okay. I have a question just around your own journey specifically with starting up Healthify. Could you like just share a little bit more about that, just so we can get a picture of what it looks like to just take that leap and to start, and some of the, I guess, some of the successes that you faced and some of the challenges that you faced along that journey with building the app?
Okay. Um, so basically, I had for a while been doing Healthify Africa projects. It was running as like I would say manual, right? So that would be from the pandemic time frame, the COVID-19 pandemic time frame. I've been passionate about helping people make healthier lifestyle choices. So I would use WhatsApp platforms to create exercises, challenges over a 30 days period, and people would join those exercise challenges. Women, mostly young people, because the whole idea was to increase physical activity, help people eat healthier, and people were in lockdown, so just get people moving a bit more for their health. We would then do tracking. So we'll track it on Excel. On Excel spreadsheet, I would have to track it for everybody. When you do your entries at the end of the day, I'll put them on Excel spreadsheets. And then at the end of the month, we'll compile that together and give feedback and say, this is how much you've done for the month. This is, good, or, do better for next month. And we encourage you and things like that. And you get a certificate at the end of the day. So I then said, I think it's time to make this. It was very tasking. I wasn't able to keep up with that. And I said, okay, I want to make this into an app, because clearly there are people who need this. And what I want this app to then do is what I have been doing manually, which is I want this app to be able to provide this exercise guides for people. And I want it to be able to track what's exercise. I want them to be able to come on the app and track what they've done, do their tracking themselves. And then I want them to be able to, at the end of the day, get a certificate as well to say, oh, I've done that. And they can have all that data in a graphic representation, because now I want them to be able to show that to their clinician if they're having conversations around physical activity, to say, oh, this is what my chart has looked like over the last 1 week or 1 month. I've been doing great, or I haven't been doing great. So that was the whole idea. So I didn't just come up with an idea. I had worked through like that process. And I did get a bit of funding from University of Manchester then when I was in school doing my master's program. And then we used that to do the initial piloting. So in creating the app, because I was working through a digital health cost line at the moment, at that time, which was very helpful. So I literally was working through that course with that app in mind, in terms of I knew what bits to do. So first of all, I have this idea. Then you do something called wireframing, where I kind of, wireframing ideally is done with paper and pen, but you can also do it with a platform called Figma. I don't know if you've heard of Figma. That's what my user interface designer used at the end of the day. But me, I did Figma. So I used a paper and did wireframing, which basically looks at every interface from the point someone comes onto this app, what the logo page looks like, what you want that logo page to do. It's very, very edgy. It's very, very like sketchy. It's very rough work initially. And then when they log in to the next step, the interfaces you want them to see, is it an intro page? Is it like a describing page of what your services are all about? And then basically all those interfaces that you see when you're going through an app. I think that was quite helpful, because by the time I had my first meeting with my tech team, it wasn't hard for them to get into my head because I had it in paper, right? So, and then I went off trying to then find who would I work with. And then obviously, like you said, they wanted to hear the raw story. And it's money. Money is the problem. So I'm thinking, who am I going to work with? And then you contact some people and you're like, oh, 10 million. And then some people are like, oh, this amount. So it's about trying to find who gets your work done in the budget that you have, or can you source more funding to support your budget, or do you then want to do? So what I ended up doing was, I'm like, you know what, I'm going to create a prototype, an MVP. So because my funding was quite limited at the time, I'm like, okay, let's just go ahead with the initial products, and then we'll talk about the next steps from there, right? So that in mind, I found a tech team, we worked together. I did most of the conceptualization because I already had that experience merging clinical and digital.
And then I had a user interface personnel on my team. And then I had the technical bits as well. And then someone who managed all the security aspects of making sure that passwords and all of those setups are done, right? So we did that and got feedback. So I already had my initial like insight from the people I had worked with on my manual bits of Healthify Africa. But as the app was being developed, I would send back to people and get feedback as well. And we would use those feedback to keep tweaking and tweaking and tweaking till we got to the final bits. So that was basically what the journey was like up until we had like that prototype. Yeah.
Okay, thank you so much, Doctor. We have 2 questions in the chat box.
Okay, thank you. So
The first
so
is
how
from Yemisi Taiwo. Okay, would you just look at it? Or I
yeah,
read
how
it
does
out?
digital health differ from global health? Okay, that's an interesting question. So when you think about global health, thinking about problems that populations are facing all over the world, right? And this can, depends on how you want to look at it, maternal and child health issues, chronic health diseases, which is kind of like a big thing now because of aging populations, particularly in the developing worlds. Even crisis management and health problems resulting from areas where there is war or crisis situations and things like that, and hard to reach areas as well across low middle income countries. So when you think about global health, these are all the issues. Think about malnutrition, all of that bit is global health, right? And what approaches people are taking to help solve those problems, even health inequalities as it stands. But when we talk about digital health, it's specific to digital innovations that are addressing health problems or health system challenges. That is to say that in global health, you can have different ways that you solve problems. And one of those ways can be digital health, solving some global health problems. But there could be other ways, like the traditional way that healthcare is provided or traditional way that health systems are supported, right? So digital health is like a component that addresses or helps to meet global health needs. Is that helpful, Yemisi? Hello? Yeah, okay, that's fine. So basically, it's not, the global health is the bigger picture. Global health is the bigger picture, and digital health is a component in it. A moment. Sorry, my daughter came in. Sorry about that. I just had to get her to, yeah, give me some time to round up. So, okay, you're welcome, Yemisi. So how do you combine digital health with surgery if you have an interest in both fields? Surgery, Elizabeth, Ajayi. Can you explain what you mean by surgery? Hi, Elizabeth. Could you please explain what you mean by surgery? Because I'm quite confused. Here in the UK, clinics are called surgeries. I don't know if you mean clinics or if you mean like surgical interventions. So
Well, I don't know. Yeah, I'm thinking she's saying, Elizabeth Ajayi, are you on? Although I think she's saying, some people specialize in surgery. So I think she's
okay,
saying
so she wants to
people
specialize in
specialize in
surgery.
surgery. Yeah, and also
Right. Okay. How do you combine digital health with surgery? If you have an interest in both. Oh, fantastic. Oh my God. This is actually a beautiful, beautiful question, because this is where digital health is happening. If you ask me now, this is particularly from, if you're looking at like medical device creation, and not just like software, but the hardware bits of digital health. That is where they're heading. So there's a very, very beautiful merge between someone that is a surgeon and someone that is interested in digital health. And just so that I think I'll just signpost you to a resource. The Royal College of Surgeons in the UK. Just type Royal College of Surgeons digital health, just to have an insight on what is happening from a surgical point of view in digital health. And you can also type Royal College of Surgeons AI and see all the work that is happening. But yes, people have been able to merge this together, particularly it all depends on what problem you want to solve. Like I said, I know of an ENT surgeon here who has recently created what we use as an otoscope, and we look into people's ears. She's created a device that then makes it possible that once all you just need to do is put it in the ear, and then on your phone, you'll be able to then visualize the inner, the middle and the inner, the middle ear basically with your phone screen, your phone camera basically, which is an innovation because prior to that, you have to go closer to the patient, look into their ears, and sometimes you might not get a good view. But with that camera now, it's a lot easier, right? So literally, like I said, digital health is where we're moving to. And at some point, it would become routine. So it would fit into everything. Everybody will be doing digital health. It's not like, to some extent, obviously not everyone's going to be a founder, but everyone's going to be doing digital health to some extent because the way you work would change. The approach to seeing your patients would change. Surgical interventions that you're providing as well, the devices will be better improved by the insight that you have. So if you're using a device and you feel this can be better, I don't like how this catheter works for cardiac interventions. So let's make it better. Let's improve it. And that's you and digital health, trying to make changes to improve patient care. So have a look at those resources, Elizabeth, and I hope that they will be helpful to you. Okay. What can you say about biomedical engineering and bioinformatics in respect to digital health? Biomedical engineering and bioinformatics in respect to digital health. Jimo, can you give me more specifics of maybe a context or something that gives me more insight on what you're asking? Because I'm not really sure what you want to know. Hello.
Jimo, can you unmute and just maybe explain? We have limited time. Thank you.
Okay, if it's related, right? Okay, that's fine. So before I answer that question, let me just talk to Elizabeth. Elizabeth, so talking about also, let me give you another practical experience of how digital health can be done by someone who is a surgeon. And let's use a low middle income country for an instance. It's been a while I've been in a surgical theater in Nigeria, but if I remember clearly, the pre-procedure checks. I'm not sure if you are currently working in surgery, but the pre-procedure checks that you normally do for patients, sometimes in some places they are quite haphazard, and that might mean that obviously increases clinical risks because there's certain checklists you need to complete before the patient's surgery starts. Like for instance, am I dealing with, is this surgery today? They've probably seen the patient in the clinic before, but today, is this surgery on the left leg or on the right leg? Is this surgery, if it's like an obstetric surgery, how many gauze have we been able to use today to count, to track blood loss, for instance, so that we can know how to plan for post-op. Like, do we need to transfuse X, Y number of blood bags and stuff like that? So that pre and post checklist that people do in theaters, in standardized, like in very functional systems, those checklists are very, very thorough and they are consistent. There's a system in place to make sure that it is done the same way, the same time, consistently is the same. It doesn't change for any situation. Now, you can decide to then say, this is not working very well in my context, and I want to make it better. So I want to improve quality of surgical care in XY location by making sure that pre and post assessments are optimized, right? And that's you trying to create an intervention. Recently, there's been a sales in the UK where someone created a virtual clinic that allows for people who have had surgeries to be monitored from their home. So instead of being at home, they go home with, I think, like a device they plug onto their chest or something. And then after a number of days, they return that. But during that time frame, they're able to track like their heart rate, their temperature, things like that, to make sure that that they're healing properly or that they're recovering properly. And if anything is not going as it should, then it brings the patient back. It alerts them, and they kind of arrange a quick review for that patient. Eventually, this is a surgeon who worked on this innovation. And after a while, somebody bought it. I heard it was bought for £7 billion. I'm not sure, but I know it was bought for a lot of money. So so yeah, there's a lot of work for the surgical field to do, right? Okay, so in terms of bioinformatics, I'm not very sure if this answer would be most relevant, Jimo, to you now. But when I think about bioinformatics, I think about big data that people are getting from, all the information, like what I just explained to you recently about how primary care is going to be changing, for instance, in the UK. It's all that information that people have collected about you over time that then feeds into machine learning and then influences how people's care would be optimized, how effective care will become, and how precise medicine will become for them. So I would think that bioinformatics over time would lead to better precision medicine for people and help clinicians to do things more effectively. So, but yeah, that's probably how I look at it. But honestly speaking, I wouldn't say I have that much insight about biomedical engineering as a whole, okay? So what are the possible ways in which digital health can improve public health in Africa and other developing nations across the world? A lot, my dear, a whole lot. I'm not sure which Eureka or Kunoye. So there are a couple of so you're probably Nigerian if I'm correct. There are a couple of digital health innovations already, trying to shape things better in any field. There is Help Mom. I don't know if you've heard about Help Mom, that looks at helping to improve vaccination uptake across Africa. Or is it Nigeria? I'm not sure where. And then there's My Paddy that is looking at sexual health and reproductive health in Nigeria. And then there's My Doc as well that is looking at chronic disease management in Nigeria. So digital health can solve any isolated, it doesn't solve a problem, but it can support problem solving for any of those health priorities that a country has. And a good way to start would be looking at SDGs, for instance, or looking at the national framework, for instance. What are the priorities? In Nigeria, maternal and child health is still a very concerning problem. So you can decide to pick up any of those areas, do your market or user research to find out what do people really need to help them solve this problem, and then use that idea that you get to solve that public health problem, and then develop your innovation, okay?
I have another question.
Okay.
Right.
Okay. I think that will be the last question for this session. Thank you. So you can go ahead.
Okay. All right, thank you. Are there any open source softwares maybe that you could point us to that could, like, just to get an idea of what's out there, what open source softwares for maybe application development or digital health that could just help us like really get into it, get some ideas and see what's being done out there?
Sorry, like you mean like a platform to help you develop an app?
Yeah, something like that, or just like open source softwares that are integrated with digital health. So I've come across a few whereby I've seen some open source softwares that link community health workers in hard to reach areas with medical doctors so that they can do like some type of telephonic intervention. So I was just wondering if like there might be a few more out there, and it doesn't necessarily have to be in relation to app development, but just some type of digital health open source software that could be interesting to look at.
So what you've described now sounds like telemedicine.
Does that fall under digital health?
Sorry?
The telemedicine aspect, does that fall under digital health as well?
Yeah, it falls under digital health. I wish I had that picture, but I think I'll just try and see if I can send that picture to the chat. The one I said Yeah, so this is the picture I wanted. This is, you just look at WHO classification of digital health interventions. It classifies for you everything. Oh, I sent it to, let me send it to everyone. Sorry. It classifies for you everything that is recognized as digital health by WHO. Have you seen it? Has it come into your phone?
Yeah, it's loading.
Yeah. So that picture, you can also browse it. It classifies everything that is digital health. Digital health includes telemedicine. It includes patient information management systems. So basically all those, if there's a hospital you've gone to and they're no longer using paper because they've gone paperless, and they are using like a digital system to manage their patient information, that is digital health. If you've gone to somewhere and they have been able to manage your care remotely without you coming in for an assessment, that is digital health. If you've had, so it's as I said, it's no longer the way people look at it, like, oh, it's just an app or something. It's going to be a merger where every service can be optimized or made better with digital health in the future.
Okay, thank you so much, Doctor. So now, okay, please, I'll just take this.
I saw one more question by Samuel Hiwa. Is it possible for medical
Yeah.
students to acquire enough medical data to feed algorithms? And through which process can this be accomplished? So talking about medical data is also important to know about, like the information governance bits of it, is that this data is not your data to have access to. And in terms of how the ethics of managing patients' data, I think if you're doing like a survey to just find out from people what their experience is with an intervention, you don't need to go through any ethical protocols. But if you're going to be using personal medical data in that large quantity enough to feed algorithms, then there needs to be some consent aspect to it. Or you might need to be working with data that is already consented from data banks. So let's say, I'm not sure, to be fair, I can't recommend any particular data banks now, but it might be worth looking into what data banks are available in your locality as consented data banks. So data banks that people already said, you know what, this is available for you for use for clinical research or for any healthcare or health system improvement processes, right? But if you're going to be collating that data from scratch, then you would need to be consenting for people to give you that data so that you can be practicing along like the ethics of, information governance and all.
Okay. I hope that's clear.
How can we know if these
Samuel?
data banks are legal? If
Okay.
you're going to be going to a data bank, it would be like a national data bank. I'm trying to think of one I used to know. You know what? I'm going to reply to Opeyemi with a number of data banks that I am aware about, right? And these data banks are normally not owned by an individual. Ideally, anything that is likely owned by an individual might not be very ethical. Obviously, the way the world is going now, to be honest, with social media and all the, I agree that we all have to tick at different points in a day when going on a website. Different organizations do have some level of data around you, but in terms of medical data, they are mostly stuck with your clinician or stuck with the national database as at now, right? For most people. So if you want to get that data, I would advise it might be what then, I can't say I know the ones that are legal or not, because I don't know what is all out there. But if you want to work with any particular data banks, it makes sense to do your due diligence of making sure that they are credible and that they are doing things in a legal manner. Right, that's for no worries. I'm going to send a link to that page. And then lastly, if anybody, I still have a couple of, I'm happy to share a couple of my book, the free copies of my book with anyone who is interested. So if you want that, you can speak to the organizers, and if you're happy with that as well, I could send some free copies of the book across to you. It's quite insightful for anybody who's looking at implementing digital health innovations in low middle income countries, because most times it's not just about the innovation that you've created, but how to get people to adopt it and sustain it can also be very, very crucial to what the outcome might be for people as well. So if that's something you're interested in, just hit them up and they'll get in touch with me.
Okay. Thank you so much. So, ladies and gentlemen, before we conclude today's webinar, I would like to take a moment to express our heartfelt gratitude to Dr. Linda. Thank you so much for sharing your invaluable expertise and so much insight with us today. It's been very engaging, inspiring, even very informative. Like, your passion is very obvious and it's even contagious. So we are so grateful for this time you took to prepare and deliver this webinar. So I'd like us to, appreciate Dr. Linda. You could just drop the clapping emoji and all of that. So with that, I would like to also appreciate every one of us for joining us today for this webinar. We appreciate everyone's active participation and engagement, and we hope you found this session informative and valuable. And then, Dr. Linda, I would like to ask for some people that have some personal questions. Is there a way they could maybe connect with you? Would you mind? Because I could.
So yeah, you can hit me up on LinkedIn. You can always slide into my LinkedIn. I'm very happy to answer questions. Just let me know that you've come from this webinar, and I would answer your questions. And I'm happy to always share resources where I find them. Yeah.
All right. Thanks so much for the opportunity. So I hope we all heard that. So look up for her on LinkedIn. Mention you're from here. Around digital health. I'll see you all next time. Have a wonderful evening. Bye bye.
All right. Cheers. Bye. Bye.
Bye bye.